I'm from northwestern Pennsylvania, around the Erie area, which is really cold weather, snow country. Basically raised there, high school there, college at the University of North Carolina, Chapel Hill, which I'm still a big college basketball fan. You get that when you're there. Went to medical school at the University of Chicago, which is not far from here. And then did my residency at the University of Pittsburgh. Spent 6 years there. And met my wife there, and I thought that that's where I was going to be. So when I left there for my vascular fellowship, again back in Chicago at the university also, and I got a job at the University of Pittsburgh, I thought that's where I was going to be forever. Was there for 3 years and still loved the place, but it just wasn't busy enough for me. Their vascular surgery program at that point was growing, but it really wasn't there. So I started looking around for a place and got connected with the people in Belleville. They needed, one of their surgeons was retiring. They needed someone to fill his shoes. I stepped into that role. That was in 1991, and I've been looking for free time since. I'm a vascular surgeon. We deal with diseases of the blood vessels outside the chest. The cardiac surgeons deal with problems with the heart and lungs. We deal with both arterial and venous diseases outside of that area, specifically blockages in the neck, the carotid arteries. We deal with aneurysms in the abdominal aorta, circulation problems in the legs. We do a lot of access procedures for dialysis patients. These are usually in the arms. And we deal with people with varicose veins and venous problems. And we also do treatment of chronic non-healing wounds of the lower extremities. I enjoy using my training, my skill, my experience to correct a problem that they have, and seeing them respond to that is really the greatest joy. When you can, when you're doing what you're trained to do and it works well, that is why most physicians are in business. They're not in business to see people get sicker or to see their treatments fail. They're in the business to see them succeed and see the people respond to that. And that's a great satisfaction. I collect comic books. I'm a big comic book fan. Along the line when I was getting interested in science and when I was younger, I started reading a lot of comic books, and I got into literature via the comic book door. And still to this day, I collect Spider-Man, Superman, Batman, and Hollywood seems to have found them because now all the Hollywood movies are about these people.